Good afternoon, and thank you for joining us for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 531 new cases of COVID-19. This brings our statewide total to 2,218 Pennsylvanians who have tested positive, now in 50 counties in Pennsylvania. 21,016 patients have tested negative to date. More than 241 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. This is about 10% of people who have tested positive, which is consistent with our previous rates and the rates in other states. Approximately 76 of the total that have been hospitalized have required treatment in an intensive care unit, and about 44 of those individuals have required the use of ventilators or breathing machines. Tragically, we have had 22 deaths associated of those who have tested positive due to COVID-19. To date, all of the deaths have been in adults. Age-related breakdowns of this data are available on our website at health.pa.gov. There are many in Pennsylvania for whom English is not their first language, and we have been working to ensure that those individuals and groups are also getting these very important updates. On our website at health.pa.gov, we have fact sheets and graphics that are translated into other languages, including Spanish, Chinese, Korean, Vietnamese, Arabic, and French. We are also now live streaming these daily updates in Spanish. But we need your help. If you have a friend or neighbor who needs this information in their native language, please share it. If you own an essential business that serves these communities, please post it at your checkout. The message of social distancing is essential to mitigate or to stop the spread of this virus, COVID-19. I want to particularly thank Pennsylvanians for practicing the social distancing that we have been discussing. I know it is not easy on families or employers, but it is our most important job now. It is critical that we practice social distancing to mitigate or prevent the spread of this very dangerous virus, COVID-19. For Pennsylvanians who are sick and staying home, it's very important to remember to monitor your symptoms very closely. If you feel like you're getting worse, particularly if you're having very high fevers or you're having severe shortness of breath or trouble breathing, please call your doctor. And if it's a medical emergency, please call 911. If you need mental health resources because you or someone you know is experiencing a mental health crisis, contact the crisis line by texting PA to 741-741. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover your coughs or sneezes with your elbow, not with your hands. Try not to touch your face, especially after touching surfaces, and clean surfaces frequently. Practicing these everyday prevention efforts can help slow the spread of the dangerous virus, COVID-19. If you have questions about your health, please contact your healthcare provider. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. What is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer the questions.
Thank you, Dr. Levine. We have a question from Lehigh Valley Live and the Tribune Democrat covering the decline in cases. So we had 531 new cases today, down from yesterday's 560. How big of a deal is that, and is this a sign that our mitigation efforts are working?
Well, first, we did not have a decline in the number of cases. We had a decline in the number of new cases. I do not feel that that decline is statistically significant. We would need to see a consistent decline in new cases over time to show that maybe we have been able to mitigate the spread or prevent the spread of COVID-19. So it is really too early to tell or to make any conclusions from the data at this time.
Secretary, Spotlight PA and WJAC have a question about beds and ventilators. Can you provide a specific estimate for how many additional beds and vents would be needed at the outbreak's peak, and if not, why?
Well, we currently have 3,400 licensed ICU beds in the state. Approximately 40% of our ICU beds are still available, although this number fluctuates from day to day. We have systems in place where we're tracking very closely the number of ICU beds that we have in the state in general and in specific areas. In addition, we have more than 3,600 ventilators across the state within our healthcare systems, and we're tracking those carefully as well. We have been working with the hospitals and health systems in terms of bed capacity. And in order to deal with the anticipated surge of patients. And so that will need the whole continuum of beds, ICU beds, traditional medical surgical beds, and then subacute beds. And so we're working on all contingency plans to make sure that hospitals and health systems have the beds that are needed. We are looking at repurposing ambulatory surgical unit beds, which could be used, and even hotel rooms for subacute or patients as they convalesce and need to get better as they improve with their illness. So all of those beds will be necessary. We do have stores of ventilators, and we are purchasing new ventilators in preparation for that surge. And so the key to being prepared and the key to being able to have our health system be able to respond is the success of these prevention and mitigation efforts. We need to prevent the spread of COVID-19, slow the rise of new cases to prevent being potentially overwhelmed the way Italy has been and New York City has been. And so we're working on that every day.
As a follow-up, CNHI had asked, based on your previous estimates, the number of patients requiring ventilators has been relatively small compared to the number of patients with coronavirus. Can you explain why so few patients have required ventilators so far, and whether there is a reason to believe that the percentage of patients who require ventilators might increase?
Well, so the number of patients that are requiring ventilator use is what we've expected. So again, approximately 10% of the patients have required hospitalization, approximately 3 to 4% have required intensive care, and approximately 2% have required the use of ventilators. That's not unexpected. And we might see more patients that are requiring the use of ventilators, or they're that sick that they need to use these breathing machines, but the numbers are consistent. If the numbers skyrocket, however, that will test our ventilator capacity, although again we have stores to be able to deal with that surge. As I said before, the key is really working all together with the prevention mitigation efforts that the governor has instituted, the school closures, the business closures, which are all very difficult, and the counties where the governor has ordered a stay-at-home directive. Those are critical to preventing the spread and mitigating that peak, which could potentially overwhelm our healthcare system.
Secretary, we have a couple of media outlets who are asking about the numbers of spiking of the spiking of the COVID-19 numbers. Is that a result of increased testing? And where is Pennsylvania in terms of our testing supplies? has the available inventory for testing materials improved?
So first, in terms of the rise of cases, which has been following this exponential curve. Today, again, is the same as the rise is the same as yesterday. We'll see what it is tomorrow and in the future. But that is what we have been seeing and what we're watching really, really carefully. In terms of, I don't think that that's from more testing. I think that that's more cases that we're demonstrating from the testing that we're doing. Right now, we're testing in a number of different ways. We're testing priority patients at our state laboratory. Those include healthcare personnel. Those include vulnerable patients, those that are hospitalized, perhaps in intensive care, those that are in vulnerable populations in nursing homes and such. In addition, hospitals and health systems are doing the majority of the testing. Many of them are doing the laboratory analysis in-house in their hospital, but still a lot are sending it to commercial laboratories such as Quest and LabCorp. And I know that there's been somewhat of a wait for results, particularly from the commercial laboratories. We have reached out to them, and we're doing everything we can to try to decrease that waiting period. In addition, there are still mass testing sites for symptomatic patients in Philadelphia and in Montgomery County on a drive-through basis. So that is the nature of our testing capacity. For this case-based, patient-based testing, right now we're doing quite well. We do have adequate supplies of the chemicals and reagents for testing. We have just gotten in a new shipment in terms of the swabs that are necessary for testing. So at this time, we have the adequate materials to continue our testing protocols.
Secretary, we have several outlets, Capital Wire, Spotlight PA, KDKA, and News Talk 104.1, asking about the peak. Is there any time when we could see a peak, say, in plateau, and what are we doing to prepare hospital systems and health systems for that peak?
So we are preparing for that peak in many different ways. We are working with hospitals and healthcare systems, as well as the Hospital Association, as well as long-term care living facilities, etc., for that rise and that peak of new cases. We're working in terms of space and bed capacity, as I explained earlier. We're working in terms of having adequate staffing for physicians, for nurse practitioners and physician's assistants, nurses, which are critical, of course, and then others, such as respiratory therapists. We'll need all of their help to deal with this surge, and not only ICU medical care personnel, but those in the emergency departments and in regular med-surg beds as well. We will need adequate supplies, such as the N95 masks and other personal protective equipment, and then ventilators, as we've been describing. And then we have emergency crisis standards of care for triage. Triage doesn't mean life or death decisions usually. Triage usually means that we assess a patient, we assess what their medical needs are, and then we implement the correct care at the correct time for the correct patient. So that is our traditional triage, which happens in emergency departments every day. We don't know when the surge is going to be. We're tracking that. We have different modeling. There's been modeling from University of Pittsburgh School of Public Health. There was an article about that in the newspaper. We also have modeling protocols from Penn, and we've recently seen one from the University of Washington in Washington State. So a number of different modelings. They all have slightly different techniques, and they show slightly different dates. Be honest with you, I would go with what Dr. Fauci said, which is the virus determines the timetable. We don't determine the timetable. Our job is to be prepared for the expected surge of patients. But again, the degree of that surge will depend on the effectiveness of our prevention, mitigation efforts.
Secretary, as a follow-up, KDKA would like to know, for Western PA, there's an aging population and poor air quality. Could Western PA become the next hotbed of cases like we've seen in other cities?
Well, we're watching many different areas of Pennsylvania. Currently, the areas that are most affected are in the southeast, so Philadelphia and the Collier counties, but we have seen an increase of patients in the west, particularly in Allegheny County, but also in Westmoreland and in Butler County. So we're watching all that very carefully. There are so many different issues which contribute to where we might see a hotspots, so to speak. Certainly the age of the population, air quality is important. Also the density of the population. How many people live really, really closely to each other? That's one of the factors which has contributed to the significant surge in New York City, which has one of the highest, if not the highest, population density in the country. So, of course, from that point of view, Philadelphia is the county we would watch. So many different issues which go into our analysis about where we might see an increase in patients.
Secretary, WNEP and the PLS reporter have questions about domestic travel regarding recommendations from coming to PA, people coming into PA from New York and New Jersey, whether they should be quarantined for 14 days. Are we considering making that an order and requiring self-quarantine?
Well, in terms of people in Pennsylvania doing domestic travel out of the state, really, our recommendation is please stay home, right? The less you are out and about with other people, the less you are susceptible to getting COVID-19, and that protects yourself and your family and our community. So only essential travel would be recommended, and if at all possible, please stay at home. We are monitoring travelers coming to Pennsylvania. There is no domestic travel ban, and I've heard nothing, no discussions about closing borders or anything like that. But we do want people to watch their symptoms and to stay at home as much as possible. We have heard that the President has talked about individuals from New York City to quarantine for 2 weeks, but there's no order from the governor to do that.
From WTAE, why has the state decided to stop the practice of tracking contacts of those diagnosed with COVID-19, thus leaving it up to businesses and individuals?
Well, so a number of weeks ago, when the outbreak started in Pennsylvania, and there were a smaller number of cases for us as well as the county and municipal health departments, we were doing that containment protocol where we would identify a patient, we would do very close contact tracing, and then notify those individuals to quarantine, etc. That was when we could figure out pretty carefully and almost all the time how a person became exposed and contracted COVID-19, either from international travel or travel to some particular places where there are outbreaks in Pennsylvania. There was an outbreak from a meeting in Boston, for example, and we could trace that really carefully. Now, in most areas of Pennsylvania, we are seeing community spread. And so when we're seeing community spread, it really is present in the community, and we're not able to track how that person was exposed. And so we have shifted with the numbers that we have to this more mitigation strategy in terms of our epidemiology, and it's a different protocol.
Thank you, Secretary. From WNEP, after a person dies from COVID-19, are they still contagious? Does the virus die when the person dies, or is the virus still active and contagious? And if it is the deceased able to be embalmed, or do they have to be cremated? So
the virus would be present on the body of someone who tragically passes away from COVID-19 for a period of time. I think we're still learning how long that period of time would be. And there are specific protocols for coroners and funeral directors from the CDC, which the Department of Health will be pushing out for individuals to care for the body.
Secretary, have there, from WNEP as a follow-up, has there been any COVID-19 cases in Pennsylvania that involve people who came here from New York and New Jersey?
Well, again, we're not able to do that contact tracing. There is community spread. So certainly if someone from New York or New Jersey came here and they had been exposed and contracted COVID-19, then they could infect others. But we're not able to do now, with a number of cases, like well over 2,000 cases, that type of contact tracing, and we've shifted from that containment strategy to a mitigation strategy. So we don't know those specifics. It's being spread in the community.
Secretary, from PA Post, as you know, a few minutes ago, the governor and you had expanded the stay-at-home order to 9 more counties. Can you explain a little bit more about that decision?
Sure. So as we track the increases in the number of new cases of COVID-19, we're tracking it very carefully across the entire state. And we know which counties those increases are in. And as those numbers increase to a significant level and we have evidence of community spread, then we discuss that with the governor's administration and with the governor, and the governor decides whether to institute the stay-at-home order. And in those new counties, we were seeing those trends, and that explains the governor's order today.
From Penn Capital Star, the legislature passed and Governor Wolf signed a $50 million bill in aid for hospitals. Can you explain how that money will be driven out? Hospitals say they will not tap into it if federal money is available. How will that distinction be made?
Mm-hmm. Well, we're going to be working with the hospitals and health systems and the Hospital Association, as well as long-term care living facilities, about what their needs are. What their needs are in terms of supplies. Do they need more N95 masks? Do they need more other personal protective equipment? Do they need more ventilators? Do they need more other types of resources? And then we'll be working to purchase those resources and then to distribute them to the hospitals and health systems. So we thank the legislature so much for their very quick action, which will help our response in terms of preventing the spread and then dealing with the spread of COVID-19 in Pennsylvania.
As a follow-up, Bucks County News would like to know how effective the stay-at-home orders have been and how will we continue to decide when non-essential businesses will be back and operating.
Mm-hmm. So we don't know yet how effective the stay-at-home orders have been. They haven't been in place long enough. It'll take weeks and weeks to see the effect. What we're looking for is a consistent plateauing and then eventually a decrease in the number of new cases that we are seeing. Of course, the total number of cases will continue to rise, but we're tracking really carefully is the number of new cases. As that plateaus and then starts to go down in a consistent way, that will show us that we're gaining a handle in terms of the spread of COVID-19. As that continues, then we'll discuss that with the governor, and decisions will be made to slowly relax some of the mitigation recommendations and orders that the governor has made, but we're not there yet.
From WPXI, if a tenant who lives in an apartment building tests positive for coronavirus and is hospitalized and returns home, what precautions should the other tenants take, and what is the responsibility of the landlord to clean the building as well as alert other residents?
So there's no indication that the virus would travel to other floors. The person would have had to been there. So perhaps the lobby or perhaps the floor that the person lives on. So there is no need to clean the entire building. If the person wasn't on the 12th floor, then there's no reason to clean the 12th floor. And so there is actually some guidance about how to clean facilities from the CDC. We'll make sure that's available on our website. And then if a person is discharged, there's specific criteria from the CDC about when they are considered not contagious anymore.
And then from News Talk 104.1, if someone has been asymptomatic and self-quarantined for 14 days, is it safe for them to resume regular activities without under the current guidelines?
So if someone was exposed to someone with COVID-19 and they self-quarantine for 14 days and they do not develop any symptoms, then the incubation period is passed and they are free to go about their normal activities. However, if they're in an area that the governor has recommended in order to stay at home, we still would like them to stay at home, but of course then they could go to the grocery store or to the pharmacy to pick up life-sustaining materials and resources for them.
As a follow-up to that, the Altoona Mirror is also asking, after a coronavirus patient who remained at home has recovered, to what degree is the house contaminated and what would need to be done about it?
Well, it would be important to clean the house thoroughly. There are some guidelines about how to do that. COVID-19 can live on surfaces. Depending upon the surface would determine the amount of time, but it's not more than a number of days or hours or days. And so we'd want to have the house cleaned, and then people should be fine.
From the Allentown Morning Call, we've received information that one of the positive cases is a patient who remains at Manor Care Nursing Home in Palmer Township, Northampton County. Can you confirm that information? And in addition, can you say what the recommended action is when a nursing home patient tests positive for COVID-19?
So we're not discussing specific patient information in terms of patient confidentiality and privacy, so I can't confirm that. But we have had nursing home patients or patients in long-term care living facilities that have tested positive. And there are specific guidelines for the nursing homes of what they can do in terms of isolation and cleaning, et cetera. In addition to perhaps the county, if they have a county municipal health department intervening, then our team will also intervene to make sure that all those guidelines are followed and that the rest of the patients and staff are protected.
Secretary, from WFMZ, how can small businesses who supply their employees with health insurance continue to do so during this crisis? Is there a specific loan for health insurance?
I'm probably not the best person to ask in terms of businesses and health insurance. For specific business information, I would reach out to the Department of Community and Economic Development. I guess for specific insurance information, I would reach out to the Pennsylvania Insurance Department. Really, the entire administration is geared towards helping Pennsylvanians deal with COVID-19.
And then another nursing home question from the Post-Gazette. A county-owned nursing home in Allegheny County reported 2 positives today. What kind of help and resources is the state providing to prevent an outbreak there?
So again, I'm not going to confirm any specific cases in a specific nursing home, but if there were a case within Allegheny County, then Allegheny County Health Department would be working with the nursing home to prevent the spread of COVID-19 and protect the staff and other patients, and then we would support them with whatever resources they need.
From Penn Capital Star, we've learned that states, including Pennsylvania, are being sent old or expired medical supplies from the national stockpile, and are being told to use them anyway. How concerned are you that this is compromising safety for physicians and healthcare workers? So
the stockpiles in states and the federal stockpile predominantly are from the outbreak of H1N1, which was approximately 2007, 2008. And most of those masks are face masks are absolutely fine. But there are some that have not aged so well, approximately 5 to 10%. And so they're pretty easy to tell if they haven't aged well because they seem brittle and they look like they're not able to be used, and those will be discarded. And then we will supply the hospital or healthcare system from our supply of whatever they need. So this is throughout the United States from the federal stockpile. We're aware of this. The vast majority of those masks are fine, even though they're older. But the ones that seem to be not usable will be thrown away, and then we'll replace them.
Our last question is from WEEU. With more counties being added to the stay-at-home order, can people still volunteer with their local community organizations or groups like Meals on Wheels for seniors if they are in a stay-at-home county? Yes. So again, life-sustaining activity is certainly allowed. So going to a grocery store, going to a pharmacy, food is life-sustaining, and so it's wonderful for people to donate their time and resources to something like Meals on Wheels or other types of food banks, etc. And we still encourage that. In addition, we encourage people to give blood because blood is necessary at this time, and so that would be another way that people can help their community and our Commonwealth. Thank you, Secretary, for the reporters whose questions we weren't able to get to today. We will be following up from the Department of Health and from the Governor's press office. Our next briefing will be scheduled for tomorrow.